Hi, my name is Julie Pekarsky. I'm a registered nurse and I work as a nurse consultant. Today we are going to discuss a very sensitive topic. It is a service that all caregivers must provide, and that is assisting patients with urinary elimination. Most of us would consider going to the bathroom a very personal function and would feel quite embarrassed if we had to ask someone to assist us to go to the bathroom. The caregiver must be aware that some people are modest and would feel very uncomfortable if someone saw their private parts or touched their private parts. We must approach patients with an attitude that demonstrates genuine concern and caring for their feelings. Some people are unable to provide proper hygiene or able to toilet themselves safely, so the caregivers must be there to assist them. Body language and facial expressions must show acceptance and genuine concern, and then the toileting experience for our patients will be comfortable and more dignified. We need to learn some basic principles of urinary care and the basic urinary system. The urinary system has three basic functions. They are to eliminate liquid waste products from the body, to manage body chemistry, and to manage fluid balance. The structures of the urinary system are the kidney, the ureters, the bladder, and the urethra. There are two kidneys that filter the liquid waste products from the arterial blood, such as acids and salts. The liquid waste product is called urine. Normal urine is clear and pale to deep yellow in color and has a slight ammonia odor. The ureters are two tubes that carry urine from each kidney to the bladder. The bladder is a bag-like container that stores the urine until it is released from the body. It is made up of muscular membranous tissue that allows the bladder to enlarge when it is filled with urine or shrink when the urine is emptied from the body. The urethra is a tube that carries urine from the bladder to outside of the body. The opening of the urethra allows the urine to pass is called the urinary meatus. The urinary meatus is surrounded by muscles that control the urine flow. Before we go on, we should define some terms. Elimination is a term that refers to when the body gets rid of waste products such as urine or stool. Urination and voiding are two common terms used to describe the elimination of urine. The term urgency refers to that sudden feeling to urinate now. I'm sure we have all experienced this at some time or another. Frequency is another term that describes the number of times a person has to urinate over a period of time. It is when a person is voiding more often than normal. They might request to urinate every 15 to 30 minutes. Urine can be described as dilute, and that term refers to when the urine has more water and less waste products. It will be very pale yellow to clear in color. This may occur when the patient has an increased amount of fluid intake or is taking water pills, which are called diuretics. Urine can also be described as concentrated. That term refers to when the urine has more waste products and less water. It will be very dark in color and have a very strong odor. This will occur when a person has an inadequate amount of fluid intake or may suffer from kidney failure. When assisting patients with elimination of urine, we have to consider some important principles of urinary care. As mentioned in the introduction, most of us would feel quite embarrassed if we had to have someone help us with urinary assistance. Therefore, we must promote independence and dignity by encouraging our patients to actively participate as much as they can in their care. When patients use the toilet, the commode, or the bedpan, it is very important to be professional and help to develop a sense of independence and dignity. To assist the patient to completely empty the bladder, we must be sure that the patient is upright and in a straight position. If the patient is not able to empty the bladder because they have not been positioned correctly, they may ask to urinate again within the next hour. Because of the sounds and odors associated with elimination, it is essential to provide as much privacy as possible for our patients. They might have difficulty voiding when they share a room or when somebody else is present and watching them. Therefore, we must remember to close the doors and the curtains. And we must be sure that they are safe. We should never leave a patient alone. When a patient is able to be left alone, we must be sure that the call light is within their reach or in their hand. Even though most people will urinate better if they are left alone in a private environment, we must realize that there are times when it may not be safe. We must look at the care plan and we must ask, is this person safe alone? If the person is unsteady or weak or they are confused, they may not be left alone. And we also must remember that we may not restrain a person on a toilet to leave them alone. That is an unsafe situation. For the patients, of course, who can't sit alone, again, remember, the call light must be within reach and in their hand. Comfort is also very important. A patient should not be in any pain because they have been sitting for a long time on the toilet or the commode or the bedpan. Please remember to answer your call lights promptly. After the patient has urinated, be sure that the skin is clean and dry. If necessary, wash the skin with soap and water or disposable wipes. Gently dry the skin with a towel. Clean and dry skin is essential in preventing skin breakdown. Also, be sure that the patient's underclothing and undergarments are clean and dry. If they are wet, please remember they need to be changed, or if you notice an odor, please remember to change their clothing. Asepsis is also very important to remember. When the patient has finished urinating and has been wiped, make sure that they have had their hands washed. The caregiver must also remember to wash his or her hands whenever they have touched anything that hasn't come in contact with urine. That would be the bedpan, the commode, the urinal, toilet tissues, wet bedding. And remember, you must be wearing gloves if you're in contact with urine. Please remember to put all these items that need to be cleaned in the proper soiled utility rooms, and then remember that you must not put soiled briefs or toilet tissue in the patient's waste receptacle at the bedside. If you do, remember to remove the bag and take it to the soiled utility room of your facility. The caregiver also must observe the urine for abnormal characteristics and report to the person in charge as soon as possible when he or she has seen any abnormal findings. We will discuss more characteristics of urine a little later. There are several types of urinary equipment you will need to be acquainted with before you assist a patient with urinary elimination.